The healthcare industry is undergoing a digital transformation. Paper records are being replaced by electronic health records, or EHRs. Telemedicine is becoming increasingly common. Medical devices are becoming more connected. This digital transformation brings many benefits. It can improve patient care, make healthcare more efficient, and reduce costs. However, it also creates new cybersecurity risks. As healthcare organizations become more reliant on technology, they become more vulnerable to cyber attacks. These attacks can have a devastating impact on patients, healthcare providers, and the healthcare system as a whole. Cybersecurity in healthcare refers to the measures taken to protect sensitive patient information and systems from unauthorized access, use, disclosure, disruption, modification, or destruction. This includes a wide range of activities such as encrypting data, securing networks, and training employees on cybersecurity best practices. Cybersecurity is essential for ensuring the confidentiality, integrity, and availability of patient data. It is also critical for protecting the privacy of patients and maintaining the trust of the public. The healthcare industry is a prime target for cybercriminals. This is not just a theoretical concern. It is a reality that has been proven time and again through numerous high-profile breaches. Healthcare organizations store a wealth of valuable data, including patient health information, financial information, and intellectual property. This data is a goldmine for cybercriminals who can exploit it in various ways. This data is highly sensitive and can be used for a variety of malicious purposes such as identity theft, financial fraud, and even extortion. Imagine the chaos that can ensue when a patient's medical records are altered or stolen. In addition, healthcare organizations are often reliant on legacy systems which can be more vulnerable to attacks. These outdated systems may lack the necessary security features to fend off modern cyber threats. The interconnected nature of healthcare systems also means that an attack on one organization can have a ripple effect, impacting other organizations in the network. This interconnectedness, while beneficial for patient care, also opens up multiple points of vulnerability. Therefore, it is crucial for healthcare organizations to invest in robust cybersecurity measures. This includes regular updates to software, comprehensive training for staff, and the implementation of advanced security protocols. By taking these steps, healthcare providers can protect not only their own systems, but also the sensitive information of their patients. In a world where cyber threats are constantly evolving, staying ahead of the curve is essential for the safety and trust of all stakeholders involved. Cyber attacks can have a devastating impact on healthcare organizations and their patients. These attacks can disrupt critical services, compromise sensitive patient data, and even put lives at risk. The healthcare sector, with its reliance on technology and vast amounts of personal data, is a prime target for cybercriminals. For example, the 2017 WannaCry ransomware attack crippled healthcare systems around the world. This attack exploited a vulnerability in Windows operating systems, spreading rapidly and locking users out of their data unless a ransom was paid. Hospitals were particularly hard hit, as they rely heavily on computer systems for everything from patient records to medical equipment. The attack affected over 200,000 computers in 150 countries, including the UK's National Health Service. The NHS, one of the largest and most critical healthcare providers, saw significant disruptions. Many hospitals and clinics were forced to revert to pen and paper, delaying treatments and surgeries. The attack caused widespread disruption, forcing hospitals to cancel appointments and turn away patients. Emergency services were overwhelmed, and the inability to access patient records led to delays in care. The financial cost of the attack was also substantial, with the NHS alone estimating losses in the millions of pounds. In another example, in 2020, a ransomware attack on Universal Health Services, one of the largest healthcare providers in the US, caused major disruptions to its IT systems across hundreds of hospitals and facilities. This attack forced staff to use manual processes, significantly slowing down operations and impacting patient care. The attack highlighted the vulnerability of even the largest and most prepared healthcare organizations. These attacks highlight the very real threat cyber attacks pose to patient safety and the delivery of healthcare. They underscore the importance of robust cybersecurity measures, regular system updates, and comprehensive training for healthcare staff. As cyber threats continue to evolve, healthcare organizations must remain vigilant and proactive in protecting their systems and patient data. The stakes are incredibly high, and the consequences of inaction can be dire. Section 5. Protecting patient data, practical cybersecurity measures for healthcare organizations. Healthcare organizations can take a number of steps to protect themselves from cyber attacks. These include both technical and organizational measures. Technical measures involve implementing security controls such as firewalls, intrusion detection systems, and data encryption. It also includes keeping software and systems up to date to patch known vulnerabilities. Organizational measures involve developing cybersecurity policies and procedures, training employees on cybersecurity best practices, and conducting regular security audits. Section 6. Training and awareness, the first line of defense. Employees are often the weakest link in cybersecurity. Phishing emails, weak passwords, and careless handling of sensitive information can all provide entry points for cyber criminals. In the healthcare sector, where patient data is highly sensitive, the stakes are even higher. Therefore, it is essential to educate staff about cybersecurity threats and best practices. This includes understanding the various forms of cyber attacks that can occur, such as ransomware, malware, and social engineering attacks. Regular training programs should be conducted to teach employees how to identify potential threats, such as phishing emails and suspicious links. These programs should be interactive and engaging to ensure that the information is retained. They should also be trained on password management, safe internet browsing habits, and the use of multi-factor authentication to add an extra layer of security. Additionally, the importance of reporting any security incidents cannot be overstated. Prompt reporting can help contain and mitigate the damage caused by a security breach. Employees should feel empowered and encouraged to report any suspicious activity without fear of retribution. By fostering a culture of cybersecurity awareness and vigilance, healthcare organizations can significantly reduce the risk of cyber attacks. Continuous education and training are key components in building a robust first line of defense against cyber threats. To Section 7, the future of healthcare, cybersecurity, AI, and blockchain. The future of healthcare cybersecurity will be shaped by emerging technologies. Artificial intelligence, or AI, can be used to detect and respond to threats in real time. AI algorithms can analyze vast amounts of data to identify patterns and anomalies that may indicate an attack. Blockchain technology can be used to create secure, tamper-proof records of patient data. Blockchain can also be used to track the movement of medical devices and pharmaceuticals, helping to prevent counterfeiting and theft. Section 8. The role of government and regulatory bodies. Governments and regulatory bodies play a crucial role in strengthening healthcare cybersecurity. They can develop and enforce cybersecurity standards and regulations that healthcare organizations must adhere to. They can also provide guidance and resources to help healthcare organizations improve their cybersecurity posture. Collaboration between governments and private healthcare providers is essential to address the evolving cybersecurity challenges. Section 9. The importance of collaboration and information sharing. Collaboration and information sharing are essential for effective healthcare cybersecurity. Healthcare organizations need to share information about threats and vulnerabilities with each other. This will help them to stay ahead of the curve and develop more effective defenses. There are various forums and organizations dedicated to facilitating information sharing and collaboration in the healthcare sector. Section 10. Cybersecurity, a matter of life and death. Cybersecurity in healthcare is not just about protecting data, it's about protecting lives. Cyber attacks can have a direct impact on patient safety. For example, an attack that disrupts a hospital's electronic health record system could prevent doctors from accessing critical patient information. This could lead to delays in treatment, medical errors, and even death. As healthcare becomes increasingly reliant on technology, the stakes of cybersecurity will only continue to rise.